Hi, I'm Darren Lachelle, President and CEO of Northern California Public Media. Welcome to our live town hall special, Coronavirus, What You Need to Know. Now, this is the 5th in our series of live town hall programs, and we do plan to go on producing these programs every Tuesday night at 7 o'clock throughout the coronavirus pandemic. And I know, like you, we all hope that won't be too long, but we will be here for you. Now, these programs are produced in association with the County of Sonoma and also with input from a variety of nonprofit partners and also public health agencies around the Bay Area. But why do we do this? We do this so that you can connect to the folks who are making decisions, so that you can ask questions of the public health officers and also of the elected officials who represent you. So how do you do that? Well, this is what you do. You email us at viewer@norcalpublicmedia.org. You can also find us on social media at NorCal Public Media, on Facebook, on Twitter, and on Instagram. And you can use the hashtag NorCalCorona as well to ask your questions. Now, I want to remind folks as well that you can listen to live Spanish translation of this program happening now on KJOR La Mejor 104.1. So that's Spanish Language Radio 104.1. Now, I'd like to thank our first guest who is here with us in the studio this evening, and we have proper social distancing in place, I do believe, but we're here with Lynda Hopkins, Sonoma County Supervisor from District 5. And Lynda, as we discussed, we're taking questions from the public to ask you various questions so that they can better understand what's happening in our community.
I look forward to it.
Great, great. Well, I tell you what, we'll start out right away with this question. How are you mitigating the lack of access to health care for those who are losing health insurance, don't have access to health insurance, or are afraid to access health care due to immigration enforcement?
You know, this is a critical question, and actually something that we're seeing on a national level right now is that some of our most socioeconomically disadvantaged folks are being the hardest hit by COVID-19. Now, we simply don't have enough cases presently to make that kind of an analysis right now in Sonoma County, so we're not actually seeing that trend on a local level yet. We're very lucky in Sonoma County to have a strong network of our federally qualified health clinics. That's like Santa Rosa Health Clinic, West County Health Clinic, that has multiple locations out in rural West County. And they can provide services for those who are, falling through the cracks. It's also critical that if you do need emergency medical attention, that you do go to the emergency room. So if it is urgent and you are in need of medical care, right, that is what you need to do, and you will be taken care of.
That's good to hear. And specifically for undocumented folks, is there a certain place that they should call or anyone they should go to for help?
Our federally qualified health clinics actually do serve a lot of undocumented residents, and so I would say that that's a great first place to start. Is to reach out to some of those wonderful health clinics. But I think that it's critical that we lift up and support our undocumented residents in this time. There's a tremendous amount of fear in the community as we have had, instances of ICE being present in the community, including at the courthouse. And so I also wanted to mention that UndocuFund is providing critical resources for our undocumented community, helping them with rental assistance, money to be able to afford groceries, because unfortunately our undocumented residents are not going to be eligible for the federal aid package that was recently signed into law.
Great. Well, that sounds like a great resource for folks to check into. Second question we have, this is about evictions. So the current eviction moratorium does not prevent evictions, it merely delays them. Many people live paycheck to paycheck and have little to no savings. How can we expect that people eventually will be able to work enough to pay back those back months of rent right away when they're asked to do so?
So this is a great question, and I want people to know that if they are a tenant, they actually currently have 3 levels of protection. Actually, even before the governor issued his executive order regarding tenant protections, we passed a tenant protection ordinance in Sonoma County. Then the governor issued his executive order, and then actually just yesterday, the Judicial Council weighed in and essentially barred evictions from happening during the pandemic, not only for residential, but also for commercial tenants. And so people are currently protected under 3 different tiers of law, and we are actually working with partners such as Legal Aid to try to provide clarity over exactly what their rights are. It is important to know that financial impacts due to the coronavirus pandemic actually are providing an affirmative defense against eviction at this point in time. It does not, however, waive the need to pay rent eventually when it comes due, which I think is what your listener was referring to. And so, that's something where I think we really need to work with our state and federal partners to ensure that we have fiscal relief packages that will actually provide support to those tenants, so that when we get through this, which we're all looking forward to, that they actually have the money in their pocket needed to be able to stay in their housing. So it's a critical issue. We're kind of at this point in local government, pulling the levers that we can pull, and then as we see what the cracks and what the gaps are, we will continue to work with our state and federal partners to address those issues.
That brings up the question of how are relationships going between local county officials, state governments, the federal government. Are you seeing a lot of cooperation there? Is it still confusing, or are things coming together?
I think that one of the challenging things is that we are all firing on all cylinders all the time. So things are happening very rapidly. County takes an action, state takes an action, federal government takes an action, and then people are kind of left wondering, oh my gosh, what resources am I actually eligible for? What public health order? Am I following the governor? Or am I following the local one? But the good news is that we are all working and pulling in the same direction right now. We all want to take care of our community. We want to make sure that they are sound and healthy, as well as economically healthy. And so I actually have wonderful relationships with all of our elected officials at the state and federal level, and we're in touch on an almost daily basis, just checking in and making sure that, are there any needs that you're seeing at the state level? What can I do for you? Just last night, actually, I was texting someone from Senator McGuire's office regarding the fact that self-employed folks are still having a hard time applying for unemployment. And so she was saying, okay, here's the phone number. We'll help walk the person through it. And I was able to get right back to them. So that's the kind of thing, is that we're doing these, warm handoffs almost. Of, if you have a constituent that isn't being, doesn't have the right answer at local government, well, let's hand them over to the state, or maybe we can get federal help. So we're all working together, pulling in the same direction.
It's good to hear that the cooperation is very strong right now. Third question here from some of our viewers, listeners. A large majority of the working class has been ordered not to earn income because they can't go to work. But the supervisors seem more worried about landlords. How many supervisors are landlords? And is the board seeking outside counsel on protections for renters? So there's a couple of questions.
Those are great questions. I am not a landlord. I actually, to my knowledge, I don't think any of my colleagues on the board are landlords, but I can't speak for them. And I think that we are tremendously concerned with the out-of-work workers. One of the things that keeps me up at night is, how long is this going to go, and what kinds of financial relief can we make available, even on a local level, even as though we're looking at, tremendous budget cuts from the county.
Right.
But you look at the federal stimulus package, and I see $1,200 check, and I think that doesn't go very far in Sonoma County. So what can we do to keep people in business? How can we reinvent and reshape our economy in a way that still allows for social distancing? So those are some of the conversations that I'm having with small business owners and employees around the county. So I do hear that pain, and I hear that fear, and I want that everyone who is out of work right now to know that I hear you and I see you, and I will absolutely work to make sure that you have housing over your head, food on your plates, and that you'll have a job to come back to when this thing is over.
Right. The part of the question about, are you seeking outside counsel? I'm not sure exactly what they mean, but is there any kind of outside advice or anything that's coming into the supervisor's office?
Well, actually, yeah, and thank you for reminding me of the last part of that question. Ronit Rubinoff from Legal Aid is a friend of mine, and we text regularly, and she has done a lot of work on, tenants advocacy and tenants' rights, and she is very well connected to other legal aids around the state of California. So she is always at the cutting edge of what are other jurisdictions doing to be able to, step up potential support for tenants. And so actually one thing that she apprised me of just last night before we discussed this at the Board of Supervisors meeting today was the fact that some renters are going to actually incur fees, right, late fees, on top of the missed rent payments. And so I brought that up at the Board of Supervisors meeting today to see if there was something that we could do to address that in an ordinance going forward, to stop the, it's one thing to have to dig yourself out of a hole, right, of missed rent payments, but then if you actually have fees, late fees heaped on top of that, it just becomes more and more difficult to claw your way out of that financial crisis that you're in.
Right, absolutely. Most of these are about social safety net issues, we noticed this time around. Why is it almost everything we need to get from stores when trying to order online is in-store pickup only? So I'm trying to avoid going to the store, but they're not making it easy for people to shop online. We have to go there in person.
That's a great question. And actually, if you go on socoemergency.org, there is a list of some grocery stores that are providing curbside delivery. There are also a number of grocery stores that have senior hour. So you can go really early in the morning when there aren't as many people out, right after the store has been freshly sanitized. So if you fall into one of those vulnerable categories medically for, being at higher risk of complications to COVID-19, there are definitely some avenues for you. I've also heard some success with people using some of those, apps like DoorDash or, there's various apps that can actually go and shop for you. I think that we're working on volunteers to be able to do this for people, because there are some folks who are homebound, for whom they don't even actually want to go out and get into the car in order to go get groceries. And so if you're an interested volunteer, you can go to cvnl.org and sign up to, do some work like that and to support those members of the community that don't want to actually go out to the grocery store and shop.
Okay, so cvnl.org.
Yeah.
Okay,
yeah,
great.
and that's where you can sign up. And then there's actually a link if you click on, I think it says COVID-19, and then you click on Sonoma County, it will take you to the Sonoma County Volunteer Center. And so you could actually support that effort and help out a neighbor in need get their groceries.
That sounds great. Another one along these lines, are there any plans to facilitate drive-through options for supermarkets, the same way places like Walgreens have instituted?
Yeah, that's not something that we really typically control in local government in terms of, dictating, mandating structural changes to a grocery store. But it might be a good question for Dr. Mase if there are ways of suggesting best practices. I have seen a number of restaurants actually shift to, that kind of a pickup window model, even ones that normally, would have people inside the restaurants. Yeah. And I actually saw something really interesting. Shelton's in Healdsburg actually has implemented kind of plexiglass frames around the grocery store clerks to try to minimize
and you're
the
seeing
air
those
transmission.
more and more often now.
Yeah, so I think that they're actually taking it upon themselves to really try to do the best they can to keep their community and also their employees safe. And Dr. Mase might talk a little bit more about some of the guidance that she's issued and the requirements that businesses actually do have a plan to create social distancing and best practices in their businesses.
Good. Now, this is a very important question, and one I think you'll be very interested in. In the communities of Vista del Lago and Bennett Valley, Doyle Park, and Montgomery Village, we're noticing a large increase in RVs and cars overnight filled with people, belongings in our neighborhood. Since the shelter-in-place began, can the county help us before we have another Joe Rodata Trail instance? Can these folks be given a legal place to live in their RVs and cars?
I think this is a fantastic question. And this is actually something that we were working very hard on before the pandemic started. Now, at this point in time, we're working very hard to stand up an alternative care site that would also have the capacity to deal with some of our most vulnerable unsheltered members of our community. So those who are over 65 or have a co-occurring medical condition. We're actually sort of looking at a triage system where we try to take some of those most at-risk homeless individuals and try to get them into shelter as quickly as we possibly can. We are not looking at safe parking at this point in time, but I appreciate being made aware of the situation, and it's definitely something that we will look into. I do want to be clear that the CDC guidance and the best practice locally is not to disperse homeless encampments at this point in time, because that could actually increase the risk of transmission of the virus. But that certainly wouldn't stop us from looking at, how can we create safe parking? How can we look at, proactively offering solutions for those folks who are struggling and living out of RVs.
Right. And could you explain for people what the relationship is between the supervisors, the Board of Supervisors in the county, and municipalities like Santa Rosa when it comes to these kind of issues? How do you talk about these and work on these things together to make decisions?
Yeah, well, I feel very lucky to serve on the Home Leadership Council, which is our continuum of care body in Sonoma County that actually allocates a lot of the homelessness funding. And so Chairwoman Susan Gorin and I serve with Mayor Tom Schwedhelm and Councilmember Ernesto Olivares, along with a number of, we've got a couple people with lived experience, service providers, and a representative from the city of Petaluma as well. And so we do actually come together to, have these conversations. And in light of the current pandemic and the need to move very quickly on issues of homelessness, we actually created a sort of leadership ad hoc where we could just check in every week and sort of talk about what's going on, in the city of Santa Rosa or in Sebastopol or in Petaluma or anywhere around the county, so that we are aware of these issues in real time and trying to figure out the best way of addressing them. Oh, and I did want to mention that we have also recently deployed hand washing stations and porta potties to some of the existing homeless encampments, and are also working on food provision to ensure that there are sort of basic sanitation facilities in place to, again, help try to prevent the spread of coronavirus there.
Well, that sounds great. Also, in the same vein, what are some places that people could go to for more information or help with homeless issues in the county?
So actually, if you go to socoemergency.org, there is
Right.
actually a tab that has resources specifically for our unsheltered or for people who are, struggling to be able to afford food. And so if you go there, there's information about where we have mobile showers, where we have, different food bank drop-offs scattered all around the county. And so those are wonderful resources. We also still do have our active intake process that you can go to, any one of the currently operating shelters to be sort of put into the system of care to try to eventually find people housing that's permanent.
Okay, great. And let's do another question here. How can we reinforce the shelter-in-place order when people are still having friends and coworkers over? They must have some personal experience here. Still having friends and coworkers over for game nights, going out to coffee, doing non-essential tasks, and not maintaining a 6-foot distance when in stores and essential businesses. So what are some advice that you can have about enforcement and how you guys are dealing with this?
I mean, I think that, we really need to be very clear that this is a matter of life and death. And that even if I, for instance, am at lower risk of suffering complications of COVID-19, if I take actions like the ones that you were just describing, I am absolutely endangering other members of the community. And so this is a moment when we have to really rise up, I think, and take responsibility not just for ourselves, but for those of us who are most vulnerable in our community. And so, my advice is just to call people on it and say, hey, you do realize that it seems like it's not a big deal. But if everyone breaks a rule, there is no rule. And if that happens, then we will see mass fatalities in Sonoma County. And, we will see that dramatic spike that Dr. Mase might talk about with respect to the modeling.
Right.
So we have kind of the nice gentle curve. We are flattening the curve in Sonoma County. That is the really good news. But it is absolutely dependent upon every single person living here to follow the directions of our public health officer, because that is what is going to keep us all safe. And, another thing actually is I'm hoping that everyone, Dr. Mase is going to talk a little bit about this later, but I had to show off my mask. So I actually got 2 masks that a friend of mine made it. I traded them for 2 rolls of toilet paper. True story. So she actually gave them to me, and then I actually just gave her the toilet paper because I heard she was in need. But, this is the new sort of style in Sonoma County, right? Whenever you're out, you want to be wearing this. And again, it's actually, as Dr. Mase will explain, this actually isn't about keeping you safe. It's about keeping your neighbors safe, right? Keeping your breath to yourself.
And doing what you just mentioned, everybody being together. Well, Lynda Hopkins, thank you so much for joining us and for answering the questions of people who, they have a lot of questions and they need answers. And so we very much appreciate you being here today.
Of course, thank you.
Great. And I want to remind folks that we have live Spanish translation of this program on KJOR, that's La Mejor Radio 104.1. That's happening right now, live Spanish translation that is available with our great partners over at La Mejor Radio. And remember, you can ask your questions for Dr. Mase coming up in just a few minutes by emailing viewer@norcalpublicmedia.org. You can also find us on social media at NorCal Public on Facebook, on Twitter, and on Instagram. So make sure to get a hold of us right away with your questions and your concerns for public health officers and elected officials. Now, we're going to take a look at a really great conversation that Pamela Lorence, who is the NorCal news reporter, has put together for us. Now, there's been a unanimous vote last week with the San Jose City Council, and they are planning to enact a citywide paid sick leave policy. Now, this is for essential workers who are not covered by the national congressional action that we heard about. And if passed, it can be one of the most comprehensive paid sick leave policies in the United States, and they're voting this week on that. So Pamela Lorence talked to Jeffrey Buchanan. He's the Director of Public Policy at Working Partnership USA. It's a great report. Take a look.
Most workers only have access to 3 days of accrued sick time. And so, in the midst of this coronavirus pandemic, when our public health authorities and doctors are saying, at a minimum, that those who may be experiencing symptoms or near folks who had been confirmed to have the virus need to quarantine for 14 days and self-isolate, it's just not nearly enough. And so really it puts a lot of workers who are now, our communities are depending on, with a difficult challenge of, do they continue to go to work to be able to feed their family, or do they protect their own health and the health of their community? So that's really why we've been focusing on trying to provide as many workers as possible access to the paid sick days they need.
And what about the recently passed federal law, the Families First Coronavirus Response Act? Where are the gaps there? Who isn't covered?
So the good thing about the federal law is that it allows for all employers with fewer than 50 employees to seek fully refundable federal tax credits for any dollars they spend on providing paid sick leave. The problem is that it leaves an enormous gap. And it says, for large employers with more than 500 employees, they don't have to do anything when it comes to providing sick days to their workers. And so companies like McDonald's or Whole Foods or a lot of these essential companies that are still operating aren't providing their workers with the paid sick days they need.
There was a group of San Jose Council members, right? They were working on a paid sick leave plan back in March. What are the differences between what they originally proposed and what was voted on Wednesday?
Yeah, so initially, when we were working with council members Esparza, Arenas, and Carrasco, the hope was to get both a long-term policy. San Jose is one of the 4 largest cities in California, the only one that doesn't have a long-term paid sick leave policy to give workers more sick days than the state minimum allows, and to cover all workers with 14 days of paid sick leave in the event of an emergency.
Over the weekend, I had a chance to chat with San Jose Council member Magdalena Carrasco. She's been vital in the push to get a comprehensive paid sick leave policy in place for San Jose workers. Here's a portion of that conversation.
This policy is good for everybody. The policy that allows you to stay home and take care of yourself when you're not feeling well, when we're in the middle of a pandemic, with one of the viruses that we know is incredibly contagious and has a greater fatality rate than what we've seen with other viruses, then that also puts everyone that they come in contact with at risk. If you're showing up sick, they're handling your food, they're handing it to you through the drive-through, you've now potentially been exposed because that individual did not have any sort of ability to take that time off and still get paid. We have the local taquerias who are still serving food and sending burritos home when our door dashers show up to their place. So we wanted to make sure that they were covered. And then we also wanted to make sure that those people who are allowing us to stay in place were covered because they were not being covered under the state mandate.
What are you hearing from small businesses? Those who have fewer than 50, right? 50 employees. What has been their reaction to this? Are they all hands on deck? We'll get support from the federal government and see it through, or are they worried?
So of course they're worried. I think everybody is just in this state of disbelief and uncertainty. We don't know what kind of real help we're going to get that's really tangible. That's why at the local level, you have to make sure that you are getting policies through that reinforce or strengthen whatever is already in place, and make sure that whatever assistance, financial assistance especially, is coming through, that it gets to our people very quickly. So again, I'll say we're not perfect. Our policies may not be ideal. They're meant to allow people to stay home, to stay safe, to stay healthy, and also not to continue spreading the virus. We must make sure that our most vulnerable are safe and that they survive this, and it's going to be up to us.
Now remember, we have Spanish translation of this program happening right now on KJOR La Mejor Radio, that's 104.1. So you can tune in and listen to Spanish translation right now with our partners at La Mejor Radio. We thank them so much for their great work, and we're glad to be able to provide this service. And remember, you can get a hold of us and ask your questions with an email at viewer@norcalpublicmedia.org. You can also find us on social media, Facebook, Twitter, and Instagram at NorCal Public Media or NorCal. We're easy to find. Send us a question, and we would be glad to get it into the program as soon as we possibly can. Now, we're joined here with Dr. Sundari Mase, who is the Sonoma County Public Health Officer. And Dr. Mase has been a part of all of our programs so far, and this is program number 5.
Great.
that we have done so far, and we'll continue to do them Tuesdays at 7 o'clock as long as we feel we need to do that for the community. So I wanted to start out right off the bat to ask you about how are things looking not only nationwide but in the Bay Area and then here in our county when it comes to cases, deaths, and what we're seeing with the coronavirus pandemic.
Great, thanks for having me. Sure. As usual, I'll give our update. So we've gone now globally to 1,429,000 cases. And we have about 81,000 cases just in the last 24 hours. Here in the United States, we're up to almost 400,000 cases, about 30,000 new cases in the last 24 hours. And in California, we're up to 17,500 cases. We've added about 1,100 cases in the last 24 hours. Wow. So yeah, still going strong, it looks like. I want to talk some now about Sonoma County specifically.
Sure.
And the Bay Area. So let's start with the Bay Area counties. We're still number 7. Santa Clara County has the most cases still with about 1,300. But we have Alameda at 634 and San Francisco at 622. And then we've got Contra Costa County with about 440 cases. We have Marin at 148. Oh, and I can't forget San Mateo at 589. So we're right behind Marin at 115. Solano County is actually getting more cases. They're up to almost 100. And then we've got our counties that don't have as many cases, like Mendocino, which has 4, and we've got Napa with 23. Lake County, I think, had their first case. So that's where we are Bay Area-wide.
Right, right.
I wanted to say that we have a few differences in where our cases are happening. So initially we thought between the different counties that we had similar numbers, but the central county is now taking off, as we'd expect. It's an urban area.
That's where the population
That's
is
where the
focused,
population
right.
is. So we have now 55 cases in the central county and closer to 13 to 17 in the other counties. So that's a change from last week. We still have about 20% of our cases ever hospitalized, and the rest are in the outpatient, like we'd expect as well. Half and half male, female. And one thing we have been seeing is a lot more cases in the close contacts. And we can talk about that later, but it's because we've been doing a lot of contact tracing, I believe.
Right, right. So that's leading to finding out that people who have close contact with people either as workers or family or those
usually
kind of
family members and some workplace contacts as well.
Yeah.
And hot off the press, today we've added 5 cases for a cumulative 120, and of them, 81 are active, and we're very happy to say that 38 have recovered by our definition. We have 1 death, and we've performed close to 2,800 tests.
Right. And so it's 1 death, not 2?
It's 1 at this point.
Okay.
Yeah.
All right.
Well, the other death was not our county. It was a Napa County death that we discussed last week.
Okay. I understood. Because I think that was a question some people had about the number there. Absolutely. So let's talk about face masks.
Okay.
So let's begin because we have a lot of questions about that this week. As you know, things have changed for the recommendation. So our first question is, this week you began advising that everyone wear face masks when going out in public. What prompted you to make this recommendation?
Okay, that's a great question. It is new guidance for everybody. And let me just review that, just so people are really clear what we're expecting them to do. What we're saying is when people leave their homes for their essential business, essential activities, or travel, that they wear a simple face covering. We're not calling it a mask because it's really doesn't need to be a mask. It can be a bandana, a scarf, or a homemade mask. And I actually have some examples I'm going to show in just a second.
Okay.
What I wanted to say is this is not to protect you from getting COVID-19 because that's the specialized N95 masks that do that. What this is going to do is if you are somebody who's asymptomatic and has COVID, it'll keep you from transmitting it to other people. So you're protecting other people wherever you go. Now you're still going to be social distancing and following all the personal hygiene measures, but you're also going to wear a face covering, and I really want to encourage everybody to do so. Now this face covering, I'm going to show you examples of, can be washed if it's a cloth mask daily. Before you put it on, you should wash your hands completely and then put it on. Try not to touch it a lot while you're out and about. And when you take it off, afterwards, you'll also wash your hands. And don't wear it if it's got holes or torn or not covering your mouth and nose.
So let's take a look at some of those.
So let me show you first. I'm going to show you what you don't want to be using. This is an N95 respirator. It's a mask that healthcare professionals should be using. It's made out of material that protects you from getting infected because the pores are so small that the virus won't get through.
And you're saying
do not
people should not
use an N95 respirator because we need these for our healthcare workers.
Right.
We have ordered a lot of these in the public health department. These are KN95 respirators, also for healthcare providers. So anything that says N95, we're not recommending that people use.
So that those can be saved and used for healthcare providers.
Exactly, because those are the ones that we have shortages of. And of course, we want our healthcare providers to be able to be safe when they're interacting with patients that may have COVID or have COVID. Now, these are two masks also that you don't want to be using. These are surgical masks. They're produced commercially, and they're made of material that's also somewhat probably more protective than the facial masks that we're, or facial coverings that we're recommending for people. These are the ones that we're suggesting that our first responders and our healthcare providers in all settings wear. Not when they're dealing with a patient that has symptoms, but even the front desk staff at the clinic or our police officers and our firefighters that are going out. We want them to wear these. These are surgical masks. Again, if you have surgical masks that are unopened, bring them to us because we could use these. These are also in shortage.
If somebody did want to bring those in, where would they take those?
The Salvation Army.
And they'll handle the distribution?
And they'll handle distribution to our emergency operations center so we can get them out to the people that we really need. Now, Supervisor Hopkins just showed two facial coverings that were masks that were homemade. Here's an example of another one that's homemade. It's just simply cloth. And there's some elastic on the top part, not the bottom, and then elastic, and this would be put around your ears, and you'd wear it in this manner. It's washable, reusable, and it's a perfect thing for you to use when you're going out. Now, if you don't want to make one of these, you can just use a bandana, you can use a scarf, or any kind of a facial covering that you feel would cover nose and mouth. So this is a good example, and there's patterns all over the internet. So please,
I was going to say, for being homemade, that's very impressive. That's a very
in
impressive
fact, somebody at work brought these, so it was very nice.
That's good, good.
So that's what people should be wearing, and we encourage it because this is what's going to help us decrease the community transmission from person to person.
Right.
And as I said last week, 1/3 of people who have COVID can have no symptoms. So those are the folks, you don't even know you have it.
You're protecting others.
Protecting others by wearing these masks.
Good.
Or
now,
facial coverings.
To follow up on a little bit more with face masks from some of our viewers and listeners, we've had a number of questions that revolve around should home caregivers for the elderly be wearing face masks, and why has the sheriff not ordered the use of masks inside jails and detention centers?
Right, so those are congregate settings in the jails and detention centers, and we haven't yet gone to assessing the risk. Now, I want to let people know we don't have a single case of COVID in the jails that we've detected, and we're out there doing some surveillance testing this week and next week in the jails, just to make sure that we don't have cases in the jail system.
But so far, there's been no one with any symptoms of
So at this point, we haven't gone to requiring or recommending masks or facial coverings in that setting, unless it's in the clinics, the healthcare clinics,
Okay, great. So if somebody is taking care of an elderly person and that's their job and they take care of them in their home, then they definitely...
I think it's worth wearing a facial covering. Again, it's very easy to confuse this, as you can see, but masks are the ones that we buy that are commercial.
Right.
The facial covering is what we're recommending for the general public.
Gotcha.
Yes.
Okay, that makes sense. Another viewer question here. Sonoma County recently commissioned projections for cases, hospitalizations, deaths about the virus in the county. Can you share some of that with us in a way that we can understand?
Yeah, certainly. So we have a modeling team that's been really great at producing some good projections of what we can expect in the next couple months. So to make it really simple, if we weren't sheltering in place, we would have seen a lot more cases than what we're expecting to see.
Right.
In fact, 5 times more. Now, what we did was project the need for hospital beds, because that's most important for us right now, to plan and make sure we have the capacity to take care of all the super sick people. So without shelter in place, we might have expected up to 10,000 hospitalizations in the next 2 months or so. But with shelter in place, it looks like we can expect more around 1,500 hospitalizations. So that's been really effective. Now, in terms of the absolute number of cases we might see, we're going to get some more data on that.
Gotcha.
So that projection is, I think for the next 2 months, we're going to be seeing more and more cases and might require up to 1,500 hospitalizations.
Well, to follow up on that, what are you thinking the projected peak is going to be here in Sonoma County? When do you think that may happen?
Right, our modeling suggests that it's going to be in about, I would say, a little less. We said 30 days last week, so maybe closer to 25 days. I'm sorry, we said 60 days last week, so closer to 50 or 55 days from now. So we're looking at the end of May or early June when we are predicting that we'll have the most cases.
Gotcha. So that's what the modeling is saying right
Yes,
now
right.
about this county specifically.
Exactly.
Sonoma County.
Yes.
Okay, great. Now, this question has to do with what you were just talking about available hospital beds. So we've read that the office was projecting the possibility of 1,500 cases to match 1,500 beds that are available. Are we still looking at a situation where we have enough healthcare capacity?
Yeah, so all of our hospitals are doing their own surge plans, and we're also helping and assisting with that in public health. So our goal is to have that capacity by the time that we need it. Now, we also have the alternate care sites. Those are the places where less sick people are going to go if need be, so that we don't clog up our hospitals. We can get people into an alternate care site where they can be taken care of when they're not quite ready to go home, but they're not sick enough to be in the acute care site. That's going to help free up a lot of beds as well.
Now, where are those sites going to be located?
Right, so we're still in negotiations and contract with potential sites, and so as soon as we've got contracts in place, we'll be able to announce where that's going to be.
Okay, great. Another question, we've had a number of questions about the stay-at-home order that's in place, about when it will be lifted.
Yes.
And what do your projections predict about when life could return to normal?
Yeah, these are really questions everybody is asking.
Sure.
We don't have all the answers. What I can say is the more mitigation measures that we put into place, the quicker we can look at relaxing some of the stay-at-home, shelter-in-place some of the aspects of that at least. So, for example, wearing these facial coverings might be very effective. So if we do this, then potentially we might find that we can relax some of these measures earlier.
Okay. Federal officials, this one's about personal safety. Federal officials have said this is a critical week to avoid trips to the grocery and the pharmacy. I have enough supplies to last about 10 days, but I am concerned that in 10 days, I won't be allowed to go out.
Yeah, let me just clarify for people that people are speaking about this as being critical next 2 weeks on a national level.
Right.
So we're looking at New York City. We're looking at some of the hardest hit areas that are ahead of us. Louisiana.
Right.
Yes. And I don't think in Sonoma County we're quite there yet. I do not at all foresee that we're going to be hardest hit in the next 2 weeks. We in California are lagging behind those places probably about a month for some of our areas like Santa Clara County and maybe San Mateo, Alameda, Contra Costa. Here in Sonoma, we're lagging behind even further, maybe another few weeks.
Behind that group.
That group. So I say that we're not going to see this in the next week or two here, and we'll keep people updated.
Now, this one's asking for specific healthcare advice. So,
Okay.
how can we boost our immune systems to help our body's own defenses to help combat the virus, whether it's vitamins or supplements or any kind of practices?
Well, I think, good nutrition, hydrating, ensuring that if you're sick, you stay at home, and don't be around other people who are out and about who are sick. Wear, essentially take all the precautions that we've already recommended, personal hygiene. If you take vitamins, I think it's great. I'm sure that they're not going to do anything negative for you. So that is, I think, a good practice as well.
Great. What is the county communicating in terms of information, cautions, and requirements given to folks who test positive? So presumably folks are receiving that news in many disparate places, and it seems like an important necessity for public health officials to establish a clear protocol for those who test positive.
Yeah, we've got a protocol in place. So the person is notified by their provider. Whoever ordered the test is the one that would get the result and inform the patient that they're positive. But then we in public health follow up immediately as soon as we know someone's positive, contact them, give them all the correct guidance, and talk to them about who they may have been in contact with.
And a couple more about testing that we've seen this week. San Luis Obispo County Public Health Department recently encouraged citizens to seek testing who even have mild symptoms. Will Sonoma County have access to encourage this same level of testing early?
Yeah, as we've said all along, we're trying to prioritize those that are sicker, the healthcare workers, first responders, congregate settings, older folks, people with underlying medical conditions. But I think people who are symptomatic absolutely need to see their provider and get evaluated. I would like to say that we can test everybody who's symptomatic, but as we've also said, we do have limited supply of testing kits and the swabs, and we're trying to get more and more. It's not our shortage. It's a national shortage, it's a state shortage. All the counties are facing this, but we're trying our best to get the supply so we can do this, and we can actually test people who are minimally symptomatic as well.
Why hasn't the health officer ordered Kaiser, Sutter, St. Joseph's to test their employees? So these are actual medical workers.
Hospitals have protocols, and Kaiser and Sutter and Memorial are actually following our protocols and their protocols and appropriately testing whoever needs to be tested. That's already happening.
And let's see, that one's a little personal. Some people online claim that representatives of the police department and sheriff's department have told them that they're permitted to go for pleasure drives. So this is interesting. As long as they don't come in contact with other people during that drive. Is that okay to do?
I think you're better off getting exercise by walking or biking. We prefer people stay close to their homes and don't drive far distances. And so I think you're better off getting exercise rather than driving around.
Gotcha. Well, thank you so much, Dr. Mase, to have you here again to answer people's questions. It's very much appreciated. Folks have a lot of questions that they want to ask, and it's great to have somebody to ask those to. So thank you again.
Well, thank you very much.
And do remember that this program is being translated in real time in Spanish by channel 104.1, that's KJOR La Mejor, and we thank our partners for that. Also, if you'd like to ask a question, get it into us now, viewer@norcalpublicmedia.org. You can also find us on social media, Facebook, Twitter, and Instagram at NorCal Public or NorCal Public Media. Now, coming up in a moment, our news director, Steve Mencher, NorCal News Director, has done a great conversation about small businesses which have been hit especially hard during the coronavirus pandemic. And so during this discussion, we talked to David Rabbitt, the Sonoma County Supervisor, also Herman Hernandez, who is the founder of Los Cien. And we start this conversation with Elizabeth Gore of the COVID-19 Business Resource Center, talking about the challenges that she's facing at home, but also giving some great information about how businesses are adapting in this time of the virus.
I can tell you our day jobs are all different now, aren't they, in the planet? Mine also consists of teaching third grade math and pre-K spelling. But at Hello Alice, our role in my company is to help small business owners launch and grow. And we are a social enterprise that is free for business owners. And we specifically work really hard with women, people of color, our US veterans, the LGBTQ+ community, entrepreneurs with disabilities, as well as our white male counterparts. But we want to make sure that everyone is inclusive to the business ecosystem. So when the very first COVID cases were starting to actually rise up in the EU, that's when we started seeing impacts of small business owners here very early. And then finally, as you saw cases here, the fear, I will say, of small business owners was palpable. And then we moved to shelter in place when fear turned into, what the heck do I do now? And so what we found was the most important thing to do was distill information. And so we worked really hard to build www.covid19businesscenter.com. And that is in partnership with hundreds of other nonprofits. As of last week, it's also the forward facing for the National Chamber of Commerce Foundation. And what it is built on top of machine learning. So based on your company's stage of growth, your physical location and industry, we are helping you unpack the federal resources through the CARES Act. We are helping you find emergency grants, whether they're from our company, Facebook, QuickBooks, you name it. And then finally, what we found has been most important is peer-to-peer support. So you can search for other owners in the COVID site and ask, okay, you're a bakery, are you still delivering? Did you pivot online? The unfortunate thing that's being accessed the most is, how do I furlough employees or pause my business? But it's important to help business owners do that with dignity, also in a way that helps them save money to reopen when this is over. So our job has just been 24/7 to distill what has come up to almost 50,000 resources a day, but make those accessible to all owners, not just those who are tech savvy. Two, are these resources in Spanish? If I am disabled, can I access them? If I'm a US veteran and I just came home from deployment, my wife's military spouse who's working, can she access them? So that's really what we built, and we're here to the bitter end.
Now, Herman, I know that over the weekend, you've been in touch with many of the folks that have made Los Cien one of the most important ways that people in our county connect. And so can you tell me what you've heard from the Latino business community and how what they're needing right now, how they're responding to this devastating pandemic?
Well, again, thank you, Steve, for having me on. And just to kind of follow just on the word fear that Elizabeth brought up, there's no doubt about the fear and not knowing what happens next. And so with many of the different business owners that I've spoken to, and several of the nonprofit organizations that I've also reached out to, I also contacted the Hispanic Chamber of Commerce, which right now is currently doing as much outreach as they possibly can to the small business owner. I just want to reiterate that currently there's approximately 6,500 Latino businesses, small business in Sonoma County, which makes up about 13% of business overall. And so many have not only to worry and to say, what is our next step? Where do we find the necessary resources just to sustain afloat, not only sustain afloat their business, but their family, where the net profit bottom line goes to sustain them. The second family being their employees, having to basically furlough their employees. And I think that when you really go in deeper, you discover there are many undocumented business owners. There have been many undocumented employees that are seeking, it's kind of like a domino effect, seeking information of where can we find support, because right now the federal government is not giving it. But there are pockets out in the community, nonprofits, different organizations that are able to help some of the employees. And as far as the employer, small business, we are trying to saturate through the Economic Development Board, through the county, through Marco Suarez, and others, Chamber of Commerce. And as this process of being able to support the businesses as this can come together with the government, being it was so quick. Many of the banks are trying to get themselves situated. So right now it's how do we sustain ourselves? How do I support my family, and sustaining on the business part, rent, utilities, family, and then when they take a break, am I going to be able to reopen?
Okay, thank you so much, Herman. I would like now, there's a couple of questions that have come in. Several of them are for David. And here's one from one of our listeners. What is the county doing in obtaining additional ventilators and masks for COVID patients? Have they contracted with businesses within the county to make ventilators and masks? Are you in touch with folks, David, who could be helping out in that way?
Well, I know my neighbor two doors down, her company, which is actually in the North Bay, they've switched their production to make masks, to actually make N95 masks, which is great. So you've seen a lot of that. The county has been, like the rest of the state and the rest of the nation, working on the supply chain issues, the shortages that are out there, making sure that we can do all that we can, both with working within the system and working on a few workarounds, which means contracting directly. And even this morning on our EOC call, we had word of—
It's Emergency Operations Center.
Yeah, I'm sorry. We had word of the county health department working on acquisition of quite a few masks through a third party. So that's what it's come down to. But, you know, I will give our emergency operations crew a big shout out. They look at every contingency. They are constantly trying to stay ahead of where we are. They plan for the worst, hope for the best, but you know, it's very important to make sure that we have that planning in place. And so there is active participation with trying to get all the materials that Sonoma County needs.
That's great. Here's another question from a listener for you. What's the correct method for the public to notify government when a business is ignoring the shelter-in-place guidelines if they're putting their customers or employees at risk?
Well, as of a couple of weeks ago, or now a week and a half, the local law enforcement is actually enforcing the health order. And they've been trained and they've been told what is essential and what is not. And they all know what the social distancing requirements are. So I think I would start with your local law enforcement agency. Perhaps not a 911 call, but just to touch in with the police. And they are very good, I know, about going around and letting businesses know if there's a better practice out there. The county has been very proactive in trying to get information out to all businesses to really ratchet up the social distancing requirements. You've seen that. Our local store here, grocery store here, has a maximum number of people allowed inside. You wait outside 6 feet apart for people to come in. The carts are cleaned. The check stands are cleaned between patrons almost. I mean, so it's very, very much ratcheted up, and that information has been sent out to wide and far to all those businesses that are open to make sure that they're safe.
Okay, and this last one for you, David, and then we'll get back to you, Elizabeth. Someone who was disappointed, and this is not a business question, unfortunately, to see in the newspaper that you were defending Christopher Godley because he flouted the rules. And what do you think about your defense? Have you also heard from your constituents that they're still bubbling about this issue that happened a couple of weeks ago?
Yeah, I have. And I communicated poorly. I will readily admit that. But what was left out of the story was the most important quote, in my opinion, that there is one set of rules and one set of rules for everyone. Quite frankly, the conversation was more about my outrage or not with what happened. Chris Godley, retired major in the Army, does a wonderful job, probably the preeminent emergency manager for all counties. Made an error in judgment, apologized, fessed up to that. I accept his apology and we move on. And that was what I was trying to convey, not very well, but it wasn't relaxing that. I understand, and I will say this, I understand all first responders, all people under pressure. I understand what they go through. I understand, we need to be a little kinder to one another as we go forward to make sure that we make sure that those people are doing the job that they need to do and they're as refreshed as possible. It doesn't mean you go to the beach when it's closed.
And I want to remind folks that we have live translation of this program happening on 104.1, that's KJOR, La Mejor Radio. Spanish language radio, we appreciate their partnership and support. And also, to get your questions in for this town hall series, email us at viewer@norcalpublicmedia.org or on Facebook, Twitter, or Instagram at NorCal Public Media. And even though this program is coming to a close, we do want to hear your questions because we're doing this program every week, every Tuesday at 7 o'clock. So we need to have those questions, and we want to make sure that you're informed. Now, every Tuesday, there is a Spanish language town hall going on KBBF Spanish Language Nonprofit Radio. And KBBF held their latest town hall earlier today from 5 p.m. to 6 p.m. And a quick update on some of the things that they talked about. Adriana Arizon, who's a health educator from Sonoma County, talked about a dashboard available at socoemergency.org, which offers information on the number of active cases, recoveries, deaths, the breakdown of ages, sexes of folks who have contracted the disease, and also you can see the impact county by county in all of California. So that is an interesting tip. Also, Cruz Lopez, who's with the Department of Health Services, reminds us that it's important to create a routine for children, especially so they can feel safer and at ease during these times. So try to limit the news and the negative information that comes into your household when you have a lot of small children and young people around. And try to structure the day because that helps the whole family to keep on track with what they need to do. Also, Supervisor James Gore was present and he talked about working hard to communicate with the Spanish-speaking community in first language programs like the ones on KBBF. And also Richard Diaz from the Emergency Services was also present and gave a lot of great information in that program, and that's kbbf.org. So we thank you for joining us for this live town hall program, Coronavirus, What You Need to Know. I'm Darren Lachelle, President and CEO for NorCal Public Media. Have a great night. We'll see you next week.